Ladies and gentlemen, we've just heard from President Trump from the Oval Office this evening. We are now joining our town hall here in Douglas County, where we have assembled a panel of experts from Tri-County Health and offices of emergency management from across Adams, Arapahoe, and Douglas counties. My name is Jim Seidlecki. I work in the county manager's office in Adams County. It's my pleasure to serve as the moderator for this evening's forum. In a moment, we'll introduce you to the panelists that will provide expert answers to the questions that you have provided to us in advance, and some that will come in throughout the course of the evening. It's important to note that the questions that are not answered this evening will be incorporated into an FAQ document that will live on the Tri-County Health website and the websites of each county involved in this evening's forum. Before we begin with the questions, we would like to introduce the commissioners, the Board of County Commissioners, and the chair from each one of the representing counties tonight. And we'll do that by introducing Roger Partridge, the chair from Douglas County, to kick things off. Mr. Partridge.
Thank you, Jim. Good evening. Welcome to the COVID-19 virtual town hall featuring experts from Tri-County Health Department. I'm Roger Partridge, Chair of the Board of Douglas County Commissioners. We are pleased to partner on this evening's event with my commissioner colleagues, Laura Thomas and Abe Layden, as well as with our fellow commissioners from Adams and Arapahoe County. Our goal this evening is to provide updates on the status of the virus in our communities and to provide information about the proactive measures we are taking to maximize community safety. Now, it's my pleasure to introduce the Chair of the Arapahoe County Commissioners, Nancy Sharp.
Thank you, Commissioner Partridge. I'm joined tonight by Kathleen Conti and our other Board of County Commissioners representatives who were unable to be here tonight. I want to thank you again for joining us, and we appreciate you being with us. I don't know whether you know or not, but Tri-County Health Department is the largest agency, public health agency in the state of Colorado, serving more than 1.5 million individuals in the 26 cities that reside in our 3 counties, Adams, Arapahoe, and Douglas counties. We want to hear from you tonight. It's really important to hear your questions. So please submit those questions via all of our websites or social media or by pressing 3 on your keypad on your phone. And tonight, we'll try to respond to as many questions as we can, but we will be following up on all of those on our county websites as well as Tri-County Health to hear from all of you and get answers to your questions, and we'll be doing that as soon as we can. Thank you very much again for joining us tonight, and I'd like to introduce Chair of the Adams County Board of County Commissioners, Emma Pinter.
Good evening. Tonight is really about you, our community. Whether you're watching the news or scrolling through Twitter or Nextdoor, your concerns about COVID-19 have made an impression, and we are happy to have this town hall to begin to answer your questions and to show our response. We want our collective community to have the most accurate information available from public health experts to make informed decisions. So without delay, let me introduce our moderator for the evening from Adams County, Jim Seidlecki.
Thank you very much, Commissioner Pinter and Commissioners Roger Partridge and Nancy Sharp from Arapahoe and Douglas counties. As we mentioned, we have a panel of experts with us, and we'll begin by introducing Dr. John Douglas, who is the Executive Director of Tri-County Health. Dr. Douglas is joining us via Skype. He is practicing what we are all preaching right now, and he is walking the walk. He felt a little under the weather this morning, so decided not to join us in person. As a matter of fact, this room is about half empty as we begin to practice some social distancing, and Dr. Douglas is doing that from the comfort of his home, but joining us via Skype. We also have Dr. Bernadette Albanese, who is a physician epidemiologist for Tri-County Health, and Michelle Ashkenazi, who is the Director of Emergency Preparedness, Response, and Communicable Diseases for Tri-County Health. Dr. Douglas, we'll kick it off to you.
Jim, thanks very much. Welcome, everyone, this evening. I appreciate the introduction by our commissioners, as well as those of you who are joining us online. This has been an extraordinary, eventful day in terms of the coronavirus epidemic. It seems like every day is an eventful day, this one perhaps more than most. We heard the World Health Organization, who's been tracking on this global epidemic, describe it today for the first time as a pandemic. That means that it's an epidemic affecting the whole globe and involving populations with serious health outcomes across the globe. Not so long ago, we heard our governor give an emergency address to tell us that the number of coronavirus cases that had been detected in Colorado had doubled in the past 24 hours. We're now to about 34. And I think other cases may be rolling in while we're talking tonight. He introduced a number of different measures that he wanted us to consider, having declared a state of emergency yesterday, emphasizing increased testing, the issue that Jim's already talked about, trying to come up with strategies for social distancing, some of which could involve gatherings such as our schools, potentially school cancellations, or other large events such as sporting events. He also talked to us about testing. Testing has been increasing in Colorado. That's actually probably one of the reasons that we saw new cases detected today. And then all of you just heard the president address the gravity of the situation with a number of different issues that or solutions that he'd like to propose. By way of quick background, COVID is a member of a quite common family of viruses, the coronavirus family. We've known about this family of viruses for a long time. Coronaviruses have been in this country for a long time. They cause about 20% of common colds. What's different about this one is that it's new, it's novel. It was probably introduced into human populations in China from a reservoir in bat populations, probably through something called a wet market in China, where there's lots of contacts between animals, fish, and humans, and then it spread rapidly, first through China, and then, as you're aware, to, I think, over now 100 countries in the world. We are struggling with this because it's a new epidemic. It spreads rapidly, although we don't know just how serious it is medically. We know that it's got a fatality rate, a case fatality rate, that's substantially higher than seasonal influenza. And although seasonal flu is something we probably take too much for granted, this is, given its novelty and given the fact that we really don't know what to expect, an extremely new and concerning situation.
Dr. Douglas, thank you very much. We do have a question for you, but we want to remind everyone that this is your forum. We are hoping to get questions throughout the evening. You can hit *3 on your phone. You can use the Facebook feed or the links that you have been provided through all of the 3 counties participating this evening. Again, *3 on your mobile device if you would like to be included with a question this evening. Dr. Douglas, we're going to begin with the question that we had from Oliver in Douglas County. He asks, what are the number of cases and deaths due to flu versus COVID-19 in our 3 counties, the U.S., and possibly globally?
Well, first of all, let me say that for the flu is vastly more common than COVID is right now. In fact, it's so much more common that we really don't have active counts of cases. Not everybody who is diagnosed clinically with the flu actually undergoes a laboratory test to allow us to confirm it. So when we talk about, how much flu is there, these are almost always projections. This year it's been estimated, and I would emphasize it's an estimate, that we've had around 30 to 50 million cases of flu across the country. The flu season's not over, usually winds down around April or May. And by the way, if you have delayed getting your flu vaccine, it's not too late to get it, not because it'll prevent COVID, but because it may prevent the flu and avoid confusion. We think that across the country now we've seen 20 to 50,000 or so deaths due to the flu. We don't ascertain that exactly because we don't always diagnose those cases. But it is generally observed to be true that flu causes, again, between 30 and 50 or 60,000 cases a year. Now that, of course, is much higher than COVID. COVID in the U.S. right now is just under 1,300 cases. We think there have, under 1,300 cases, and we've seen about 37 or so deaths nationwide. So that sounds like a minor problem compared to the flu. But of course, as you are reading or hearing daily, this problem is increasing, which is why it's gathered our attention. We don't really have good statistics for how much flu there is in our 3 counties precisely. We know that this has been a moderate to severe year. and we think we're experiencing proportionally what we've seen in the U.S. nationally. I will note that the one flu statistic we monitor pretty accurately, pediatric deaths, we've had 3 of those in Colorado this year.
All right, Dr. Douglas, thank you so much. Several people wrote in with a question for Dr. Albanese, and for those of you who are joining us right now, Dr. Albanese is a physician epidemiologist for Tri-County Health. Doctor, we want to start with this question that was introduced by John, Sarah, Elisa, and so many others. It comes in multiple parts. If you get the coronavirus, can you get it multiple times? Or is this a one-time sickness? They also ask, how long is someone considered contagious? What is the known recurrence rate? And if you get COVID-19, then make a recovery, is it known yet whether you will develop antibodies to protect yourself, or can you get it again? I know there's a lot on there, but go ahead and start with the first.
Thanks, Jim. So based on current data, there haven't been reports of getting this virus more than once. So it appears to be a one-time sickness, at least in the time period that we are looking at right now. So this is a relatively short amount of time that we've had this pandemic now spreading through the world. And so we realize I think there's been measurements that you get some short-term protection, and again, we haven't documented any recurrent infections during that time period. But now that this has become a pandemic, when we look at previous pandemics, for example, the H1N1 pandemic that we had some years ago, once that event finally improved and resolved, that virus persisted in our communities around the world during flu season. So it actually has become a common virus that we have seen since subsequent flu seasons. To what extent that might happen with this novel coronavirus has yet to be seen. So it's possible that we will work through this pandemic, hopefully sooner than later, but whether that virus may then come back sometime next year or in future years or in certain parts of the years have yet to be seen. In those circumstances, it's not yet known whether if you got infected now and in a year or two or now this virus reappears, whether there would be protection in the future.
Thank you so much, Dr. Albanese. As we mentioned earlier, Michelle Ashkenazi is the Director of Emergency Preparedness Response and Communicable Diseases for Tri-County Health. And for those of you who are not familiar, all of our counties work together on a lot of issues and certainly lean on Tri-County Health as the largest local health agency in Colorado. Michelle, this is a question about that emergency response. Can you tell us how Tri-County Health is working with local governments, schools, hospitals, and the state to help contain the spread of the virus?
Sure, that's a great question. Thank you. So at Tri-County Health Department, just like a lot of other public health departments, we're utilizing our public health emergency operation plan that's really been developed so many years ago so that it can include guidance related to pandemic and community containment. And we've also activated our public health incident management team. And in light of that and all of the systems and processes we built, it also has included building strong relationships with our emergency management and our health and medical partners so that we can really make sure that our response is proactive, strong, and collaborative. So our partners are extensive. We have strong partnerships with our emergency managers from our counties and our municipalities, with our hospitals, our EMS and fire partners, our behavioral health partners and coroners, with our schools and law enforcement and ancillary care, and really everyone who's impacted by the health and medical component of a response. So we work together really closely with our partners. We share information. We're able to provide technical expertise. We're able to provide guidance and resources and to really ensure that we have that coordinated response. We also have coordinated plans and we have integrated systems, so when things like this happen, we all know how to work together as seamlessly as we can. An example of something that we did recently is we worked with our partners and we posted information for our schools earlier this week on our website so that they had some provisional school guidance to utilize in light of the current situation. And so on our website now, on our coronavirus page, we've provided information like that. Again, it's things that we can lean on each other and make sure we have that information and support to help with our partners.
Michelle, thank you very much. This is certainly an ongoing and evolving situation. We're going to return the focus to Dr. Albanese. This is from Jane in Arapahoe County, who asks, if I tested positive for flu, does that mean for sure that I don't have COVID-19? She asks, why was I also not tested for COVID-19?
Thank you. So before I get into the specific answer for that question, let's talk about how this disease spreads and make sure that we lay that groundwork. So this disease spreads through exposure to the droplets of an infected person's nose or throat that get released into the air, into the close proximity when they cough or sneeze. So an infected person has that germ in their nose and throat. When they cough and sneeze, there are droplets that get released from your mouth or from your nose that sort of flow through the air and eventually land down. And usually that happens within close proximity. So Michelle here is just a few feet away from me. If I were to cough and sneeze or directly into her face, she could potentially be exposed. Generally, we use a limit of 6 feet around an infected person who might be coughing and sneezing as sort of that most high-risk area. So if you were in a close proximity, you get a cough or sneeze, it is possible that that virus can enter your eyes or nose or your throat as a result of that exposure. Also, what can happen is the virus, again, within that area, that 6 feet area, can land on a surface and temporarily contaminate that surface. And so if, again, I was coughing or sneezing and I was infected with coronavirus and temporarily contaminated a surface, if you touch that surface or a doorknob or a keyboard, and then without washing your hands, you touch your eyes, nose, or mouth, that's another way that the virus can inoculate into your body. So a lot of our prevention measures that we're going to talk about are to prevent that type of exposure. So that's very important to know. We do not believe that this virus is transmitted through the air in far distances, which is distinctly different than measles, for example, which can travel through the air for a long period of time and for far distances. This is different. This is by droplets, those respiratory droplets, so about a 6 feet area around an infected person. So why is that important to answer this question about, if you were tested positive for flu, but they didn't test me for COVID? So in Colorado right now, the state health department and local public health agencies has recommended to healthcare providers when a patient comes in with the symptoms of coronavirus, which can include fever, cough, shortness of breath, difficulty breathing, to assess the possibility of other causes of that patient's illness and to what extent the coronavirus might be the cause. Dr. Douglas just explained that we still have a lot of flu going on around our communities right now. It is the winter season. Not only are there flu viruses, there's lots of other routine respiratory viruses we see this time of the year regularly. Right now, those viruses are more common than the coronavirus. And so for any given patient who may not have a specific travel history or a specific history that they know that they've been exposed to someone who's been confirmed with the coronavirus disease, there may very well be another explanation. So we ask providers to do flu testing when possible in patients like this with those symptoms. We ask them to test for some of these other common viruses. And if those tests come back positive, like the flu, and the provider's like, boy, this really sounds like the flu illness, that is a very reasonable alternative explanation for the illness. And so coronavirus testing may not necessarily be done. So that's how we are trying to explain it to our providers and to the questions that we get from the public.
Great. Thank you, Dr. Albanese. A reminder for everyone who may be joining us after we started the live stream this evening, we can take questions through our social media sites. We can take questions by hitting *3 on your cellular phone. We have some of those questions coming in. We also received some questions in advance. We'll pose another one of those now, and this one goes to Dr. Albanese as well. Question from Eden in Adams County. They ask, are young children 0 to 5, they've defined that, at a higher risk for extreme or fatal responses to COVID-19 than the general population with no history of respiratory illness?
It's a great question. So interestingly, up to this point, the impact of this disease on children, not just under 5 years of age, but we define under 18 or 19 years of age, has been minimal. The data that we have from China, the provisional data that we have from China, shows that only about 2% of their cases have been detected in children under 19 years of age. There was another separate report from an outbreak in China in a very specific region that got followed over the course of several weeks that reported an infection rate in children. About 2% of their cases were in children. As the outbreak progressed, a slightly higher percentage of cases occurred in children, up to about 13%, but still relatively low number. There have not been reports from China or the U.S. yet about severe illness in children either. It seems right now in the data that we have that the people most at risk for having significant disease are older aged adults, people with significant underlying medical conditions like lung disease or heart disease or diabetes or weakened immune systems. So we haven't seen severe disease in children. Now, that being said, a vulnerable child who has significant underlying health conditions or has a weak immune system could, in theory, have a higher risk of having a severe illness should they get infected. And so our guidance about prevention, and thinking about people who might suffer more from this disease is going to include anyone with significant underlying conditions.
Thank you, Dr. Albanese. We want to remind everyone that this is a rapidly evolving situation. The answers you're being provided with tonight are the best possible answers today. As we learn more, these answers might change moving forward, but so far I think we've covered general questions. It's just worth keeping in mind as this pandemic spreads around the world. This question is from Rosie in Arapahoe County, and it's for Dr. Douglas. Is it only respiratory individuals, previous or present respiratory problems, that this really has a drastic effect?
First of all, let me apologize for coughing. I do have a respiratory infection, so I understand my cough is periodically emerging. The group that's at greatest risk, as Dr. Albanese has already suggested, of getting serious illness is those with underlying respiratory disease. And that's because this is a respiratory virus. It causes upper respiratory symptoms, and then in approximately 20% of individuals, it causes more severe lower respiratory symptoms, often requiring hospitalization, and in about 5% or so of those individuals being serious enough to require ICU care and even a ventilator, which is a hospital-based intensive care machine to support breathing. Keep those percentages in mind, because when we talk about the expansion of the epidemic and what we're trying to do or what we're trying to avoid, one of our change in our system of providing adequate health care, you heard the president say we've got a terrific health care system, is how much capacity we have in ICU beds and in ventilators. So people with underlying respiratory disease are absolutely at the greatest risk. Others that appear to be at great risk are those who have underlying heart disease, diabetes, or abnormalities of the immune system. It does appear, and it's really striking, as Bernadette said, that older people, even those older people that don't have any of the above, also appear to be at greater risk of infection. I mentioned some fatality rate statistics earlier, and I think it's worth reminding ourselves when the governor and the president said, look, older folks really ought to take care, is that the fatality rate goes up progressively the older we get. So for people below 50, it's less than 1%. It's way less than 1%. If you get in your 50s, it's about 1 to 1.5%. If you get in your 60s, it's somewhere around 3.5%. In your 70s, it's around 8%, and in your 80s, it's around 15%. So when we begin to think about, oh, this is really spreading through the community, who do we need to be careful about protecting? It's those folks with underlying illnesses, and especially those folks who are increasing in age.
Thank you so much, Dr. Douglas. We have some questions pouring in, and we thank you all so much for those questions that are coming in through social media and through so many of the other avenues. Again, *3 on your cellular phone if you'd like to add a question. This just came in, and Michelle will direct it in your area because it's about emergency management. The question is, how are our first responders protecting themselves and the general public when they are called out? What sort of guidance are you providing to our emergency responders?
Thanks. That's a great question as well. So we do have guidance that's been provided both from the State Health Department as well as the CDC. And so we have guidance that we've provided to our first responders to ensure that they understand the type of respiratory precautions they should take, just like they should in any type of situation where they're concerned about exposure. And so they have this guidance to implement and utilize so that they can make sure that they protect themselves. And we have continued to ensure they have this. Additionally, we've provided opportunities through our state partners to have webinars where they can learn additional information and have additional training to make sure that everyone is prepared and up to date on what is most current and available.
Thanks, Michelle. We're going to talk about communicable diseases, so we're coming back to you, Dr. Albanese. We have a question from Dave in Douglas County. He asks, how much backtracking of places and people do you try to do in an effort to alert people that may have come into contact with an infected person?
Thank you. We wanted to have the opportunity to explain the public health response when we hear about a case. It's extremely important for everyone to understand how that works. So when someone who has been confirmed to be affected with the coronavirus is reported to public health, we obviously take that situation very seriously. We have a prompt, if not immediate, response. So when we interview the individual, we ask them about their symptoms. We ask them when their symptoms began. So we sort of have that date of when they may have become infectious and at risk for spreading the infection to other people. From that point forward, we ask them what they have done pretty much every day. Where have you been? Who have you been around? Were you at work? Were you visiting other family? Where else did you go in the community? Have you had visitors in your home? Things like that, so we can sort of understand the scope of where exposures might have occurred. With that information, we take into consideration what I explained earlier, which is that the disease is spread when someone coughs or sneezes, and those respiratory droplets are put into the air in approximately a 6-foot area around that person. So we combine that information to identify those people who we have the most concerns about that may have had a concerning exposure. Those are typically household members or other close contacts that were in that area, in and around an infected person for a prolonged period of time. We then figure out who those individuals, or sometimes it's a group, or sometimes it's a setting that may have a larger number of people, and we undergo notifications that a possible exposure might have occurred, and we give guidance to those individuals to monitor their symptoms. We assess whether they're currently having symptoms that may already indicate that some spread has occurred, and that kind of assessment. So we take this very seriously. We want to prevent spread in the situations that we can identify where something might have occurred, and we do that notification. On some instances, we've had to implement quarantine. And so quarantine is when we ask someone who's been exposed, who isn't yet ill, to take steps to keep away from other people, maybe that's staying home from work, staying home from school, and monitor their symptoms for about 2 weeks. So one thing that I need to mention that I mentioned earlier, if you have been exposed to someone with coronavirus and that infection occurs in your body, it can take up to 14 days after the exposure for your symptoms to develop. The range is from about 2 days up to 14 days. So we ask for people who might have been exposed to monitor for the development of symptoms in that 14-day period.
TJ asks a question similar, Dr. Albanese, so I'm going to cut half of it out because you answered the first part of it in your previous answer. He wants to know the difference between quarantine and isolation. What is forced quarantine? And then he asks the question, what is social distancing?
So again, we use a term, these are technical public health terms. We can't seem to get around them, but that is it. So again, quarantine is when someone who we believe has had a worrisome exposure, who might get infected and might develop symptoms, that we ask them to distance themselves from other people through that incubation period, through the time up to that 2 weeks where they might develop symptoms. So when we want to enforce quarantine, we do that through, we can do that through a notification, we do that through a letter, sometimes we do that through a public health order, and we say, you must stay home, you must stay out of school, you must stay out of childcare, you can't travel, we don't want you to go on public transportation, we don't want you to go on a plane or a bus or a train, we don't want you to take a taxi, we don't want you to use ride-sharing services, and we want you to avoid public places. Basically, we want you to stay home. And we work with them to make sure that there are arrangements so they can get, food and other provisions. And nowadays, with the commerce that we have, usually that can be arranged. So basically, the goal is for them to stay away from other individuals for 2 weeks from their last exposure, and then monitor their symptoms if they develop any illness. If they develop illness, then they are given instruction on who to report that to, and if they need to seek medical care, we try to alert the healthcare facility that they're going to be going to seek care, that someone may be coming that might be infected with coronavirus, so that steps can be taken prior to and immediately when that person arrives, putting a mask on them, getting them into a medical exam room promptly, keeping them separate from other individuals that may be in a waiting room, and then they have their medical evaluation, and the healthcare workers caring for anyone known or suspected to have a coronavirus infection must take specific precautions to protect themselves. They need to provide care. These patients need care. That is what needs to be taken care of, and we need to do that safely. So there are very specific precautions for healthcare workers. So let's talk about, so then that's quarantine. Isolation is the public health term that we use when someone is sick and we think either known to be infected with coronavirus or highly suspect to be infected with coronavirus. You're sick now. You need to stay away from other people. That's it. That's what isolation means. So when we get a case of coronavirus that has been confirmed, or we have someone who's been in quarantine, for example, who gets sick, they are now isolating themselves. You must stay away from other people. This is a primary prevention measure, not only for people who we know have coronavirus, but for people who are sick and have symptoms, and that evaluation may be underway. And so you stay away from other people. You must stay home. And then we have isolation precautions in hospitals as well. And again, with cases, we issue them a public health order to mandate that they stay home. So lastly, social distancing. Social distancing means distancing yourself in social situations. So we do that, and we asked, there are steps that can be taken to restrict larger members of the community from gathering in places that bring them into close contact. This is one measure that can help us slow or stop the spread of infectious diseases, including coronavirus. So the first layer of social distancing is things you can do yourself, okay? Things that you can do yourself. So for coronavirus infection, it means that you can make the decision to stay 6 or more feet away from other people. If you see someone coughing or sneezing, move away. Distance yourself from that person. You can consider not going to crowded places like the movies or the malls or the concerts. Now, public health can also, including the governor, including state and local public health agencies, can also mandate social distancing measures through our public health authority in a community. And those mandates can be closing buildings, closing schools, canceling public events. You are already seeing in the media, I've been seeing this over the past few days, some examples of decisions being made about social distancing, either being mandated, and I've seen that happen in New York, I've seen it happen in San Francisco, where they are saying you must cancel events with more than 1,000 people or events with more than several hundred people. That is an example of social distancing. More and more public figures, public social figures like performers, singers, sports team owners are making the decision on their own with advice from either the CDC or from their local, state or local public health agency to change events, to reschedule events to some months down the line. Maybe the pandemic will have slowed down by then. Or holding sports events, games without fans. These are also examples of social distancing, and I applaud those groups, those organizations for thoughtfully thinking through whether something like a decision like that is made voluntarily on their part to prevent the spread of illness. And so you may be seeing that coming out of areas that are having sharp rises in spread of disease, and where, you know, they understand that we're all in cities and towns where gatherings happen on a daily basis, and they're voluntarily making the decisions because they think the risk is simply too high to bring a lot of people together in close contact.
And we all heard that decision today. March Madness, both the men's and women's tournaments, will be without fans this year. So echoing some of the sentiments that you have when it comes to social distancing and the difficult decisions so many folks have to make when it comes to the spread of this. Dr. Douglas, we want to get to a question for Sheriff Tyler Brown in just a moment, but this is a really important top-of-mind question for so many families that are tuning in tonight. We have children that are about to go on spring break, and so many of us make travel plans, whether it's to stay within the state of Colorado, travel domestically, or even internationally in some cases. Please provide an overview of what folks should consider, Dr. Douglas, as they're evaluating any travel plans they have with their family during spring break.
So this is really a huge and very immediate question. And actually, in this regard, Jim, Tri-County pulled together what we call provisional guidance about 3 or 4 days ago to try to outline not trip-by-trip specific information, but general things that one ought to consider. So as you've already pointed out about 6 times tonight, things are changing fast, and your plans to go what looks like a great place that may be safe may change tomorrow. So number one, you got to be nimble, because this may change. Number two, you need to think about the fact that more and more places are undergoing what's called community transmission. We haven't really talked about this tonight, but the original cases we were seeing in Colorado were people that pretty much knew where they got it. I was in China, I was in Italy, they had a lot of infection going on. I came back, I got sick, that's how I got it. There were other cases where someone knew they'd been exposed to somebody with COVID, and that was the source of the infection. When neither of those things pertain, you're just living your life in Douglas County or Adams County or whatever, and you're not aware of any particular exposure, and you get sick. That's when we think we're beginning to have, if you will, invisible chains of transmission to the community. The president tonight said, look, a lot of Europe has got lots of transmission going on. So in addition to South Korea, China, and Iran, these are countries that we really want to discourage travel to. A couple of days ago, same sort of comments made about cruise ships, especially for the elderly. So think, number one, about where you're going and be attentive to how quickly that might change. Think, number two, about the fact that if you get to a place that's not really experiencing a lot of transmission now, but could rapidly in the future, number one, you could get sick. If you're a kid or a young adult, probably not such a severe illness. If your grandparent's going along with you who's got a more severe health condition, or frankly is just older, that person may be more vulnerable. So think about who's going with you. Thirdly, think about the fact that things may change fast, and you might have to cancel your trip. Now, most of us have made travel plans. I've got travel plans I'm going to have to deal with myself. But if you're making them at the last minute, do so in a way that you can get refundable investments if you're buying a ticket. Many airlines are offering that now because you may have to change at the last minute. And then think about the issue of you may get to a location and either get sick and have to stay there because you're in isolation, Dr. Albanese just described that, or because you get exposed and you're in quarantine and you may have to stay there. While we have been talking tonight, it was breaking news that Tom Hanks, the actor, is in Australia, just diagnosed with coronavirus infection, is going to be staying there with his wife for an unknown period of time because he's in isolation there and can't move. So in summary, I think it's really challenging. Frankly, many of us had been thinking, gosh, we live in a beautiful state. Let's drive to the high country over spring break. Let's cancel our trip to Florida. Well, the governor told us tonight that given a number of cases going on in our mountain communities, we need to be more vigilant about that. So lots of considerations. no clear guidance except being aware that there's infection happening in lots of places. And wherever we go, we have to be really attentive to uncertainty.
Dr. Douglas, thank you very much. There is a lot happening, as we have discussed moment by moment. In addition to the Tom Hanks news that you just delivered, I was just handed a slip of paper that let me know that the NBA has suspended the regular season, and that was in response to coronavirus, the spread. They have decided not to play their games in front of live audience or empty arenas. They have decided at this point to suspend their regular season. So we're learning new information this evening, moment by moment. This is a rapidly evolving story. Sheriff Tyler Brown is with us. We also have Sheriff Rick Ragenborn from Adams County. If you two gentlemen could make your way up here. The question is for law enforcement, and this question is, are there any guidelines for people who call 911 for emergencies? Sheriff Brown?
Jim, thank you for that question, and thank you, community members. We're asking community members to report any symptoms that they might have that are associated with the coronavirus. Our 911 dispatchers will also be asking emerging pathogen questions to make sure that we're addressing those needs appropriately. Regardless of your answer to those questions, we will continue to send services to your home when they are requested. We just need to make sure that we are preparing our deputies and our EMS staff with the appropriate PPEs, their personal protective equipment, to respond to that emergency appropriately at your home. So thank you for that question.
Anything to add, Sheriff?
So nothing to add from our part, other than our dispatchers are actually asking those questions ahead of time to make sure that we're getting everything answered promptly and efficiently to both protect the firefighters, EMS, and law enforcement. And then we're also instructing our officers to vigilantly wash your hands with soap and water, and as a last resort, use antibacterial.
Thank you very much. So we have a lot of questions that continue to come in. We want to thank everybody who's watching from the comfort of their home. *3 on your cellular, or you can also ask those questions through the social media channel. You may be watching us on live tonight. Again, we are broadcasting here from the Douglas County Public Hearing Room. We have medical experts from Tri-County Health. We have the support of mayors in the room, as you heard earlier, from county commissioners from each of the participating counties. Let's get back to the questions that we have here, and this one is for Dr. Albanese. The state announced there was a location set up for community specimen collection for testing. We'd like to hear a little bit more about testing availability in the state.
Thank you, Jim. So early on, testing for coronavirus was being done solely at the Centers for Disease Control and Prevention, the CDC, because they were the ones that had developed the assay, and they wanted to get testing started quickly. So the state's health departments were sending specimens there. The next phase was then the CDC finishing up preparing the testing kits and making that available to state health departments around the country. I know that test had to be tweaked a little bit, but is now in the hands of the state health departments. Then that was a phase that we were in for a bit. Now added to that are large commercial laboratories, meaning the laboratories that doctors in their private offices and some hospitals use as backup labs from their own hospitals. So labs like LabCorp, Quest, Mayo, ARUP. These are just examples of some of these large commercial laboratories that really do a lot of patient testing. If you go to your doctor's office and you get a blood count, or they check your electrolytes, things like that, it's probably that one of those labs may be doing that testing. These large labs that have services all over the country are also now testing for coronavirus. That is a huge, huge, abrupt increase in the availability of that test all over the country and all over Colorado. It also allows doctors and healthcare providers in outpatient private offices more access to the test for their patients. The CDC has updated recommendations on precautions that healthcare providers need to use when they're collecting specimens. So because, as I said earlier, the virus of an infected person or someone who is sick, who needs to be diagnosed, is in the nose and throat, the samples that we collect to test are a swab of the nose and a swab of the throat. And so the CDC is revising their guidance on what a provider needs to do if they're going to be swabbing your nose or throat, to be able to do it safely, and to make the situation in an office to be able to do that test more reasonable, so that more healthcare providers can do that. So we fully expect more testing to be done, and we fully expect to hear about more cases now that testing has become available. So in Colorado, it can be done. Your healthcare providers who suspect coronavirus, concerned about coronavirus in a patient with consistent symptoms, and the state health department has criteria and recommendations for when to consider testing in patients who have symptoms. We are not testing patients with no symptoms. I will tell you that in Colorado, that is not, we do not recommend that happens. So we recommend testing for patients who have symptoms, and we are continually updating providers on the scenarios of when testing may make a good idea. So someone who has traveled, as we've been talking about, and has coronavirus symptoms, someone who's been in close contact with someone confirmed with coronavirus and has symptoms, people who are in the hospital who have a severe illness that can't otherwise be explained, also a consideration. We're looking if we have outbreaks of respiratory illness that we don't really know the cause, that may come to mind. People who have significant underlying health conditions that Dr. Douglas and I have been mentioning, another high priority group, and then for healthcare workers or first responders that may have some symptoms. So these are the groups that we are focusing our attention on in recommending testing, and the test availability has greatly improved literally this week.
Great, thank you very much. I want to shift our attention to Dr. Douglas for just a moment. We have seen plenty of reports, Dr. Douglas, as you mentioned earlier, the number of cases doubled over the last 24 hours here in Colorado. The number of impacted communities has also risen quite a bit. This question comes from Catherine in Douglas County. She asks, is it safe to eat and drink at restaurants in these affected cities or counties? We're talking about sit-down restaurants, fast food, takeout. What, if any, precautions should folks take if they want to go dine out in areas that have been impacted by coronavirus?
So that's a really good question, because it's one of the practical places that we visit when we're living our life. And certainly everybody who's talked about how do we live during the coronavirus epidemic tries to express balance. We're not trying to lock ourselves in a shelter. We're trying to take appropriate precautions. What I would say about restaurants is the following. First of all, your risk is not from the food. It's going to be from other people in the restaurant. That could be other diners, that could be wait staff, folks who have mild infections and don't take precautions, or folks that actually don't even know they're infected yet. If you are in those categories that we've mentioned over and over again, older people, people with underlying disease, I think this is a pretty good time that if you do go out to eat, to try to go when it's not very crowded, because, again, it's that social distancing principle. Secondly, if you do go, be aware of the kind of things we've talked about. If people are coughing near you, move away. We've probably only talked about hand washing about a dozen times tonight, so let me add a 13th time. Wash your hands while you're there, because while getting coughed in your face is a great way to get exposed, so is wiping your hands on some object that somebody who may have just coughed and covered their mouth might be touching. So I think frequent hand washing in that sort of situation can be important as well. And frankly, just be vigilant as to what's happening. The State Health Department has done us a great favor by beginning to put up regular notification on a daily basis of where the positive tests are occurring. So we know, for example, sadly, largely because of a visitor from Australia, that there are a number of cases in Pitkin County. Now, I wouldn't say don't go to Aspen, although the governor said if you're in one of the high-risk groups, be somewhat careful about it. But if you do go there, just be aware that this is a community that does appear to be experiencing community transmission.
All right, Dr. Douglas, while we have you, this is another question top of mind in my household, and I'm sure so many others that have kids in the public school system. What triggers would be enough to cause a school closure? Community spread, deaths, a positive COVID-19 test within a school? What is that threshold from your standpoint?
Well, by the way, this is not a simple question, Jim, as you know, but it is It's more than spring break, top of mind for anybody who's got kids in schools. And frankly, it's top of mind for anybody in a community. The governor offered some guidelines tonight that it sounds like he's interested in promoting at the state level. We've been working on guidelines locally, but we actually like the idea of having some sort of common approach at the state level. What he said in his press conference tonight is if a student or a teacher tests positive for COVID, close the school for 72 hours, put it through what's called a deep cleaning. That's to give us extra guaranteed insurance that the environmental contamination possibility, don't know that much about it, but possibility can be ruled out. That if there are multiple cases in a school, that it ought to be closed for 2 weeks or longer. And that finally, if there are multiple schools in a district, realizing that a district is a geographic location, so a middle school and an elementary school may involve neighborhoods that involve the same people, that multiple schools or even all the schools in the district ought to be closed. Now that's not written down, or at least I haven't seen it written down. And he said, and I strongly believe, that when that begins to happen in the school, the first thing the school ought to be doing, and ours have been doing a great job of this, is talking to the local public health people. Hey, listen, it looks like we've passed that trigger. What do you think? Are we overreacting? Are we underreacting? How to play it? So I think we'll see more, I hope very soon, because all of us want to kind of get this clear in the next day or so about what that means. But that appears to be the emerging guidance at this point in time.
All right, great, Dr. Douglas. One more for you here. Mark from Arapahoe County has this question for us this evening. Does a kit exist to test for COVID-19 at home?
Now, what a great thing that would be. The answer simply right now is no. I guess the only thing I would say maybe is that there's lots of energy among diagnostic companies trying to produce vaccines. We do have home testing kits for other sorts of conditions. You can do a home pregnancy test kit, home pregnancy test, for example. I would not expect that anytime soon. It's absolutely not available now. You need to go to the kind of location that Dr. Albanese talked about. Maybe in the future, certainly not now.
Great, you teed up Dr. Albanese. The next question is for you from Jerry in Arapahoe County. His question for you, Dr. Albanese, will Tri-County Health and or some other government or NGO entity have test kits and test protocol available soon with or without a doctor's note?
So as I explained just a few minutes ago, right now the testing outside of the public health arena, through our state public health laboratories, has markedly expanded, as John had, Dr. Douglas had mentioned as well, through the laboratories that provide a huge volume of diagnostic testing for healthcare providers all over Colorado for all that routine testing. So that surge is hugely increasing capacity, probably far and above what our state health departments could ramp up ourselves. So I think the state health departments were the way to get the ball rolling and increase some opportunities for testing. And now that we have these commercial laboratories on board, I think that's the primary direction that they're going to go. I have not heard through our public health channels that there are other governmental entities that are exploring creating testing kits. The setting in which the CDC and these commercial laboratories have been able to develop. Now remember, when we develop a diagnostic test for coronavirus, we want that test to be accurate. I mean, really, it's extremely important. You want that test to be accurate, to say, I confidently can say that your test is negative, or I can confidently say that your test is positive. That's important. We don't want a sloppy test that just would really wreak havoc. So these entities that are following the Federal Drug Administration, FDA rules for how to develop a test, and they have rules and procedures in place to get tests rapidly approved under emergency use when we have these emergency situations that we have here in coronavirus. And so those laboratories are following those FDA rules and getting those tests rolled out and using the structure that CDC has created, those templates, to be able to move that forward. Over time, you will see some of the larger academic hospitals, so research hospitals in our state and in other states around the country, also that have large health systems, will also be working with the FDA to bring tests on board. That's also going to increase our capacity. So I think that's the environment that is going to improve access to testing more so than what we'll be able to see specifically through state health departments.
Great. Dr. Douglas, this question is for you. It's one we've heard quite a bit about, and I've heard some rumor speculation, so here's your chance to hopefully clear things up when it comes to the spread decreasing as the weather warms up. There is this mindset that once summer arrives, that this will either dissipate or go away altogether. Where do you stand on that?
I stand hopeful that it could happen, but I stand that we have to plan for the worst that it won't happen. Some respiratory viruses, including other members of the coronavirus family, do show a seasonal behavior. They come when the weather gets cold in the late fall and the winter, go away in the mid-spring. We don't really see them that much in the summer. That would be a great scenario here. An even better scenario would be not only that it went away in the summer, but that it went away like an earlier coronavirus epidemic called SARS did back in 2001, 2002, when it went away and it just didn't come back. Now, this has spread so far around the world that I think that particular it's going to go away and never come back scenario is really unlikely. So I think it's too early to tell. I would say that the fact that we've got cases scattered throughout the southern hemisphere, including Australia with Tom Hanks, suggests that in places which are hot, and Australia, as you know, has been really hot this year, certainly transmission can happen. So we would love for that to happen, are not banking on it. And frankly, if it did begin to diminish but not go away entirely, it could behave like seasonal influenza, diminish when it gets warm and come back up again. So I think the myth that it's going to go away, or at least the hope, let's put it that way, is certainly unproven, and frankly, my gut is unlikely to happen. You know, if you don't mind, Jim, while I've got the mic,
Sure.
If I could say one more thing about the testing, because that's such an important question. One thing I do want to point out is that as testing has been rolled out in the U.S., we're all eager to get testing available broadly throughout the state. There have been fits and starts with this. Some of the fits and starts have been due to the fact that the original test that was rolled out didn't work as well as we wanted. As Dr. Albanese said, we've got to have tests that work accurately, had to be called back. But there have been intermittent reagent shortages. Now, I'm really hopeful that what we're hearing from Washington and the FDA, that we've got it figured out this time and that's not going to happen, is true. But I just want everybody to level set. That kind of thing could happen again. And if it does happen again, public health agencies would have to potentially re-triage testing toward those that were at greatest risk. So, for example, we wouldn't want to be having a situation, if we had a test shortage, where anybody who wanted a coronavirus test could get it, and we didn't have enough for hospitals or nursing homes. We've really got to be aware that unpredictable things can happen in terms of supply chains, just like they have been happening with the epidemic.
All right, one more for you that just came in, and we want to thank everyone who is participating through this online forum, whether it's through social media or by hitting *3 on your mobile device. This question, I'm going to leave it open to either Dr. Douglas or Dr. Albanese, and it's, should kids stay away from playing on playground equipment in their neighborhood park?
That sounds like a pediatric
John
question for Dr. Albanese.
I'm a pediatrician. So the equipment, so when you're in a common area like a park, and you have that equipment in playgrounds is what we call a commonly shared surface. It is. And so it always has the possibility, you know, at any point in time, on any given day, how many kids have been on it, how long have they been on it, and so forth, that it can, the surface of it can become contaminated. So there is a risk, a potential risk of exposure in that setting if there were children with coronavirus, actively symptomatic with coronavirus, that had used that equipment within a short period of time from when subsequent children use it. So I think that is potentially an issue. Without seeing a lot of disease in children at this point in time, and the the epidemic really evolving in Colorado, I can't give you a specific risk number or probability that an exposure may occur. So we don't have a recommendation specifically from public health to say close all the all the parks or all the equipment in a park. That's not a universal recommendation. So I think it's a judgment call by the parent. Now, that being said, if your child is one that has underlying health conditions that we mentioned earlier, where they have issues with their immune system or they have some significant health problems, take that under consideration, that for that higher risk child, for that vulnerable child who, if they develop infection with coronavirus, may have a more severe course of illness, maybe that's a decision you do want to make about your children, or take under consideration as to whether that's the best way to do that. Perhaps there's other ways for your child to get wonderful exercise that is healthy for them, that may not involve touching playground equipment.
All right. Sally from Castle Rock asks a question that I'm going to direct to Dr. Douglas, because earlier during our forum, Dr. Douglas, you had referenced some statistics as the coronavirus is impacting different demographic populations. Sally asks, are older people recovering that have gotten the virus?
Oh, yeah. It's not by any means universally fatal in older folks. The recovery does appear to take a longer period of time. And frankly, it's sort of a general rule of thumb that with any kind of infectious disease, the longer you are sick and the more seriously ill you are sick, the longer the recovery is. So you can sort of assume if you're sick enough to make it in the hospital, it'll take you longer to get well. If you're sick enough to make it to the ICU and you survive, it'll take you even longer to get well. And if you end up on a breathing machine, a ventilator, it'll be longer yet. But absolutely, this is not uniformly fatal. Again, I think the case fatality rate in people even over the age of 80 is not higher than 20%. So we absolutely want to avoid it. But, you know, thank goodness most people are not succumbing to the infection even at extremely high ages.
Sure. So 80% of those over 80 are recovering, and that's a very positive sign.
Again,
Thank you, Doc.
They may be wiped out for a long time, but they're recovering. Yeah.
Sure. All right, so let's talk a little bit about how long the surface life is on a desk or a keyboard, and we'll probably direct this question either to you, Dr. Douglas, or if you would like, Doctor, you can take it as well. Dr. Albanese, go ahead, take a shot at it.
Sure. So the quick answer is, because this is a brand new virus, brand new strain of the coronavirus, we don't have that completely sorted out yet. The general hunch is that when the virus leaves the nose and throat through droplets from an infected person's mouth and nose and it lands on a surface, that it can stay on there for a period of time. But we don't have the data yet on how long that might be. Sometimes for some other germs, it can be a matter of hours. For some, it could be a couple of days. So we don't know. So I think that gets us back to the prevention measures. And I hope, Jim, we can spend a few minutes at some point before we close to talk about prevention. So again, try to avoid touching commonly used surfaces. Wash your hands after you do that, and avoid touching your eyes, nose, and mouth. But we can expand on that, hopefully.
We certainly will. And we want to remind everybody that even during this forum tonight, this has been a rapidly evolving situation. The answers that you're hearing tonight could change as the days and weeks progress. Make sure you're checking the Tri-County Health Department website for the most up-to-date information. All right, so let's get back to some of the questions that we have from folks that have called in or sent them through social media. And this is a question for Dr. Douglas. Is it possible COVID-19 has been circulating in the U.S. since the month of January? I and many others had a cough, fever, and congestion during that time with no travel restrictions from China in December or January. Is it possible this has been circulating around Colorado and the United States as far back as January, Dr. Douglas?
Once again, the most honest answer is we don't absolutely know. I think you could say, oh gosh, anything's possible. And so I don't think it's completely impossible. I think it's highly improbable. And the reason I say that is that the sentinel chicken, if you will, the person that gets sick enough that we know we're going to get it, is somebody who is really sick in an ICU, and we've got testing equipment around. And I think that we would have been seeing, even if we didn't see people with flu and, young adults with colds and things like that, that we simply didn't diagnose. I think we would have seen that excess sicker population, and we did really in January begin to have testing kits available for that population. So it came, it probably, the Seattle experience says this was spreading around, may have come in when some folks from China were repatriated to Snohomish County, may have come in then and may have led to transmission that ended up in that big nursing home outbreak. At least that's what a genetic analysis from a virology lab would suggest. So earlier than we think, but I don't think it's likely to have been circulating very broadly that early. And frankly, as Dr. Albanese has already said, the vast majority of the things that were making all of us sick in January were the flu, coronavirus, adenovirus, other kind of respiratory virus. So possible, I think extremely unlikely that it was common.
All right, one more for you, Dr. Douglas. Then we're going to allow for some prevention opportunities for Dr. Albanese. This gentleman writes in and says, I'm a custodian. I'm 66, healthy, but not active. I clean a high-traffic building every day. How can I stay safe at the place of work and even at home?
Well, if you're in a high-traffic public place, you want to be attentive to the kind of things we've talked about, not to sound like a broken record, but anybody there, ideally try to, at this point in the epidemic, maintain some sort of distance if you can. If you see anybody coughing and sneezing, keep your distance from them. As an aside, by the way, it's not necessarily this gentleman's responsibility, but I'd say all of us ought to be, just like we haven't talked about it, I'm going to steal Bernadette's thunder, fist bumping when we see a friend or meet a stranger as opposed to shaking hands. I think if we see people coughing or sneezing into the wild blue yonder and not covering their mouth with their hands or a tissue or their elbows, we ought to begin to get comfortable saying, excuse me, that's not a good thing to be doing right now. That's not, again, this gentleman's responsibility, but I would say that's something all of us ought to be thinking about. If you are sick, stay away from your work. I'd like for one of the key messages here to be those that are feeling sick is to stay home. Really, you guys talked about the fact that I'm actually not that sick, but I was coughing, so I decided to stay home. I think as much as possible, if we can be doing that. The last thing I'd like to suggest to really anybody in that sort of situation, again, broken record, hand washing, hand washing, hand washing. And if your work is too busy and you can't get into a restroom to wash your hand sanitizer, which is in short supply, is a good adjunct if you can get it. So those are, I think, reasonable general precautions. The final thing I would say is that if you're still actively working at age 65, you're probably pretty healthy, but to be attentive to the fact that those of us, and I'm in that category, in our 60s need to be a little more attentive to the fact that we're vulnerable and to be paying closer attention to what's happening in our environment.
Great, Dr. Douglas. We have questions that continue to come in. I'll grab another one here, and I'll remind everybody the questions that we do not get to during this evening's forum, and we're in the closing minutes here of it, will be posted in an FAQ document that will appear on both the Tri-County website, so Tri-County Health's website, Adams County, Arapahoe County, and Douglas County will all post that FAQ document on their website once it's complete. Give us a day or two to work through the volume of questions we have received tonight. We will post that with good answers as soon as we can, hopefully sometime over the weekend. All right, so the next question before we get to prevention is, do you recommend people not go to the doctor if it's simply for an annual checkup, especially if you're in a higher risk group? Dr. Albanese?
I think that's a question best posed to your provider. It's impossible in the whole spectrum of checkups. So is it a checkup and you're completely healthy? Is it a checkup and you have conditions? I think that's a great question to propose to your provider, who can explain to you the precautions that they are taking in your offices. And we have asked all healthcare providers in hospitals and outpatient settings to take very careful precautions around if they have to evaluate sick people, how to separate them and to do screening for possible coronavirus infection in their offices and so forth. So I would advise that you call your provider and speak with them about the necessity for that visit at that point in time or something that could be rescheduled.
Great. All right, we want to give you a moment to speak a bit about prevention. This is something that is critical for everyone to hear. This is an epidemiologist, a physician, someone who is an expert in their field. So Dr. Albanese, what is your message to all of those watching at home as it relates to prevention?
So please listen. Please listen to this advice. This is the best advice that we can give you. This infection is spread from person to person. That is how we are seeing the disease spread. Someone is sick, they're coughing and sneezing, other people around them getting exposed, environment getting exposed. We've already emphasized how important it is to stay home when you're sick, and you're hearing about extraordinary measures from the federal government and our governor to help in situations about work and loss of pay and so forth to try to address that. But this is spread from person to person. I firmly believe, and I'm passionate about this, that we need to change the social norms about personal hygiene and about staying home when you're sick in all of our communities. We are in this together, and it is going to take everyone in our communities to pay attention and to change the social norm about preventive steps and to encourage this in your families, encourage this in your friends, your relatives, your neighbors, and your communities. Wash your hands. Wash your hands a lot. Wash your hands with soap and water. Yep, sanitizer is a little bit short supply, but when you wash your hands, you rub thoroughly, both sides, your wrists, either rinsing it underwater or using hand sanitizer. Wash your hands a lot. Avoid touching high-touch surfaces. When you're opening doorknobs, have a tissue if need be. Use your elbow to open a door. So you try to avoid these high-touch surfaces. At your workplace, clean your, use, thankfully this virus, when you're cleaning the environment, this virus, you can use routine disinfection, the Pine Sol, the Lysols. I'm not advertising anything, thank you, but just routine household cleaners that you can get in the stores to clean the areas that you commonly touch in your home and in your workplace. Speak to your employer about their workplace cleaning practices to get some reassurance that they are taking this seriously and that they are doing appropriate cleaning, if not extra cleaning. Avoid touching your nose, face, mouth with your hands. Risk of introducing the virus onto your face, which can inoculate your body. Avoid sharing cups and utensils. They come in contact with your mouth. Your mouth has respiratory secretions. If you drink and then share, and you happen to be sharing with someone who may have infection, then you may have an issue. If you have an illness and you have to cough or sneeze into your sleeve, avoid getting it on your hands. There is advice about using a tissue, cough into a tissue as one way to keep the droplets from spreading out of your nose and throat. That's fine, but then you must immediately wash your hands. So if you do that, go to the restroom, wash your hands, use your hand sanitizer if you have it. Otherwise, cough into your sleeve to prevent it from spreading into the air. We've talked about seriously looking at your non-essential travel and making decisions about that. If you are an organization that has an event with large numbers of people being planned, think about whether it is necessary to hold that event. Think about what the logistics are to potentially cancel the event. What would it take? What's the feasibility? How would you communicate it? Understand the impacts of potentially canceling it, and think seriously about whether that's an appropriate thing to do. You're already seeing some social norming around that to be making good decisions to protect the public. This is extraordinarily important. This disease spreads from person to person. We have to break that chain of spread by distancing ourselves, staying home from when you're sick, and practicing things that keep your hands clean and the environment that you're around that you touch frequently clean. We must do this together. It's extraordinarily important. You can tell how much I really want to stress those points. So thank you, Jim.
You're very welcome, Dr. Albanese. We are in the closing moments. Dr. Douglas, we'd like to give you a couple moments to share some closing thoughts.
Well, first of all, I want to thank the folks that were smart enough to have organized this event, and really do appreciate the support of all three of our counties in coming together on this important effort, and as well as those of you who have joined us tonight. Several of us have said over and over again what an extraordinarily important notion community effort to deal with this is going to be. This is not a vaccine preventable disease. This is not a disease yet that we have an antiviral that will treat people who get infected. That means the kind of frankly clunkier things that we've talked about, hand washing, social distancing, being careful with travel, changing our norms about covering our mouths and things like that, being responsible to each other. It's really critical that we think about those things, because addressing the coronavirus epidemic without draconian measures in society that we'd like to avoid and yet we'd like to produce health really does take this kind of community collaboration. So I think the sort of support that we've seen tonight for sponsoring this, and hopefully those who have seen the event, who will now have, as Jim said, not carved in stone information, because it will change, but some pretty solid information to help share with your families, your neighbors, your friends. We haven't actually talked about disinformation. America is awash in disinformation, including the COVID epidemic. And I think the more we can get right thinking about this, share it, behave appropriately, the stronger we'll be, and the greater the likelihood is we'll come through this epidemic safely and healthily together.
Dr. Douglas, thank you so much. The Tri-County Health website, the CDC website are both great resources moving forward for the most up-to-date information locally here at the Tri-County Health. If you're traveling or if you have family members, refer them to the CDC website, both great resources. And we want to thank all of you who joined us this evening. We want to also thank the folks who joined us in our audience tonight, our county commissioners, Sheriff Brown, Sheriff Ragenborn, Mayor Kaufman, Mayor Pindell, Mayor of Bennett is here with us, Mayor Pindell, and our city and county managers from North Glen, Bennett, Castle Rock, and Adams County, all of our local governments who really helped promote this forum tonight. And we want to thank our local media partners for sharing this important live stream so that we could reach as many of you as possible with the right information. As Dr. Douglas just pointed out, there's a lot of information floating around, so make sure you're getting it from a reputable source, whether that's Tri-County Health or the CDC. A special thanks to our experts from Tri-County Health. We want to thank you, Dr. Albanese, Dr. Douglas as well. We had a great turnout tonight. Michelle Ashkenazi from the preparedness wing of it, our two sheriffs with their answers to our questions, and everyone who tuned in. We sure hope that you found this information helpful as you make your plans to move forward in these ever-changing times. Have a good evening.